Senator Reynolds.
Thank you, Mr President. My question is to the Assistant Minister for Health, Senator Nash. Can the Minister update the Senate on what the government is doing to encourage doctors to practice in rural and regional Australia following her recent announcement at the Rural Medicine Australia 2014 conference?
The Assistant Minister for Health, Senator Nash.
Thank you, Mr President, and I thank Senator Reynolds for her question. Mr President, I've been listening to those in the health sector for quite some time about the current system for workforce programs. Mr President, I'm very pleased to advise the Senate that it is this government, unlike the previous Labor government, that is working towards fixing those issues and making sure we get the right doctors with the right skills to the right places. The first thing we're going to do is fix the current system for workforce programs, the ASGC-RA system, the failed system under the previous Labor government, and we're replacing that with the modified Nash model. This will ensure we can get much greater detail into consideration of those areas where we are trying to encourage our doctors to go. And that system will allow that greater detail to be utilised. I will be putting that towards first the incentive program, the GP Rural Incentive Program, appointing an expert panel to consult with the sector to ensure that we make the changes right, that they most effectively and appropriately deliver what we're trying to do, and that's getting those doctors to those areas where we need them most. We are also updating the current District of Workforce Shortage system. This is an outdated system that has been using old figures for far too long. That will be updated to better reflect actually on the ground how those numbers look and how they work out in those regional areas. And we will also be expanding the Bonded Medical Places program to cover not only areas of District of Workforce Shortage in terms of return of service, but also for towns of under 15,000 people. Now, we know that all of these are going to contribute greatly to improving the ability to encourage our doctors to areas where we need them most, particularly out in those smaller rural and regional areas.
Thank you, Minister. Senator Reynolds. Supplementary order, Senator Cameron. Senator Cameron.
Thank you, Mr President. Will the Minister advise the Senate how this announcement has been received by rural and regional doctors?
Minister.
Thank you, Mr President, and I'm pleased to advise the Senate that these long overdue changes to rural health have been very well received. For example, the Rural Doctors Association of Australia said rural doctors are celebrating changes announced by the federal government that will result in more doctors and better access to health care for the bush. Professor Richard Murray, the immediate past president of ACRIM, said this is an example of good public policy in action. It will make it easier to attract doctors to where they are most needed in communities across rural and remote Australia. While the AMA President, Associate Professor Brian Owler, said, "We congratulate the government for engaging with the medical profession, hearing and understanding the concerns of country doctors and their patients and delivering a positive outcome," which stands in stark contrast to what those in the Rural Doctors Association thought of the previous Labor government's policy approach, describing the ASGC-RA as an abomination of a scheme and putting a suburb of Hobart, Wagga Wagga and Gundagai in the same section is a joke, Dr Mara said, pointing out the failed Labor policy of the previous government.
Thank you, Minister. Senator Reynolds, a final supplementary question.
Thank you, Mr President. Can the Minister advise the Senate what else the government is doing to improve health in rural and regional areas?
Minister.
Thank you, Mr President. In addition to these very important changes to the health workforce reforms, I'll just remind the Senate about our recent budget initiatives. $238.4 million over 5 years to double the Practice Incentives Program teaching payment for general practices who provide teaching opportunities to medical students. $52.5 million, Mr President, for a minimum of 175 grants for existing general practices in rural and regional settings to provide additional space for training, teaching, and $13.4 million over 3 years to support around 500 additional scholarships targeted to areas of workforce shortage, and additional $6 million to current funding of the Royal Flying Doctor Service for essential services in rural and remote Australia. Mr President, when it comes to improving rural health outcomes, it is this government, unlike the previous Labor government, that is going to ensure we get the right doctors with the right skills to the right places.